Welcome to week 4 of our clinical psychology class. This week is actually where the rubber hits the road in terms of psychotherapy. So in chapter 11, 12, and 13, which we cover this week, we're dealing with general issues in psychotherapy, psychodynamic psychotherapy, and humanistic psychotherapy. And just to kind of you in your discussion, you get to compare and contrast Carl Rogers and Sigmund Freud. So that'd be interesting to see what you're thinking about that. I believe that both therapies or approaches, theories, have great tools for us and help us understand our clients. So if you're thinking about general issues, the good news is therapy works. So that's awesome. And the chapters talk a little bit about the idea of efficacy versus effectiveness. We've talked about that before, where effectiveness is really, does it work in the practical clinical environment? Efficacy, what does the research say about it in terms of in experimental settings or research settings? And, the clinicians aren't necessarily that influenced by the research, which is too bad because there's a lot to be gleaned from research. And so what do I see as clinical practice? Myself, having been in clinical practice for decades and having taught about psychology for decades, I see it in a simple way this way. Okay, so I think that you go and get to know yourself with the help of the therapist, and that's an exploratory journey. And what you find, you come to accept, and you get to know that as yourself. So it's sort of like, in a way, therapy is not changing yourself, but finding more of yourself and becoming more of yourself. And then the third step is to make it work for you. So explore yourself, accept yourself, make it work for you is a simple approach to this, which of course is the work that has been done by the client, not necessarily the therapist. Although the therapist has to know something, right? And so when we talk about the effectiveness, there's like a lot of effectiveness and efficacy of therapy. Here's a recent article that talks about the effect of 15 evidence-supported therapies for adult depression, for example, a meta-analytic review. And so there's a lot of meta-analysis around, and the book points out to you that every type of therapy seems to work, with the exception, and that was sort of in this article, is that psychoeducational, courses or workshops don't necessarily work. So that's not psychotherapy. We set that aside. And when you look at the psychotherapists and psychotherapies, there are the common elements that we talk about, and then there are the specific elements. And so the common elements is what Wampel talks about, and I mentioned that to you before. And those are the common factors like therapy, relationship building, the therapeutic alliance, building, coming to an agreement, a joint vision of what the therapy will do. All of those aspects are the common elements, and they make a big difference. And as long as you have those common elements in place, then just about any type of therapy direction works. One caveat I have to put into place there, and that is, in my experience, and that is in regards to adolescents, group therapy works better than individual therapy. So there might be some caveats in terms of specific disorders, specific client setups that you have to kind of sort of keep in mind, where some things work better than others. So those are some ideas in terms of general issues. Then when we talk about psychodynamic relationships, psychodynamic psychotherapy, one of the big contributions of Freud was the knowledge of what is the unconscious. And exploring the unconscious and in psychodynamic therapy, all of those kind of elements are a great help when you're trying to do this first step, helping the client to get to know themselves and their behaviors, their motivations, their the relationships with others, and knowing about themselves so they then can accept it, which is, in my mind, where the humanists come in then, right? It's like the humanistic therapy with empathy, unconditional regard, genuineness, some of those aspects that, again, helps with the common elements. And that, of course, helps the client accept themselves as they are. So those are some interesting therapies. Now, you do have a task also where you're supposed to develop an in-service training into motivational interviewing. And I found a little website that might interest you, and I'm going to share that in this announcement. That is, you learn in the book that Dr. Stephen Rollnick is certainly one of the founders of motivational interviewing. And I see here he has a website where he actually trains people in motivational interviewing. So I thought that was pretty interesting. And here he's got like these different modules and all kinds of ideas. So maybe you want to contrast some of your thoughts about how you would create that in-service into motivational interviewing, similar or different from Dr. Stephen Rollnick, just for some thoughts. So I hope that you enjoy week 4. It's definitely the practical application of all of our clinical psychology in the client work. And so, as always, feel free to contact me, get a hold of me, let me help you, and have a good week.